As more female physicians enter the workforce, they face persistent challenges that can lead to burnout, including pay inequities, discrimination, and an imbalance between responsibilities at work and home. To tackle those issues, 6 leading healthcare associations, the American Academy of Pediatrics, the American Academy of Family Physicians, the American College of Obstetricians and Gynecologists, the American College of Physicians, the American Hospital Association, and the American Psychiatric Association, funded by a grant from the Physicians Foundation, have formed a partnership that brings together early to mid-career female physicians for networking, mentorship, and leadership training. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly, Senior Writer in AHA's Washington office, and your podcast host. In this podcast, our Vice President of the AHA's Physician Alliance, Elisa Arispacochaga, talks with women's physician leaders who are participating in the Women's Wellness Through Equity and Leadership Grant Program.
Welcome to another in AHA's ongoing series of podcasts where we focus on important issues facing clinician leaders. I'm Elisa Arispacochaga, Vice President of the AHA's Physician Alliance, and today we're talking with women physician leaders who are participating in the Women's Wellness Through Equity and Leadership Grant Program. The AHA's Physician Alliance joined with a consortium of 6 organizations, including the American Academy of Pediatrics, Academy of Family Physicians, the American College of Physicians, the American College of Obstetricians and Gynecologists, and the American Psychological Association, to develop a program to address wellness and leadership needs for women physician leaders over the next 18 months. Joining me is Dr. Heather Farley, Director of Provider Wellbeing at the Center for Provider Wellbeing Institute for Learning, Leadership, and Development, iLead, for Christina Care Health System in Delaware. She's also Associate Professor of Emergency Medicine at the Sidney Kimmel Medical College at Thomas Jefferson University. She serves as AHA's representative to the WEL Steering Committee and brings her wealth of knowledge to this work. So welcome and thanks for talking with me.
Thanks, Elisa. I'm happy to be here.
To get us started, why don't you tell me a little about yourself and your organization?
So my background is in emergency medicine. I'm trained as an emergency physician. I work at Christina Care Health System. We are located, our flagship hospital is in Newark, Delaware. And then we have several satellite campuses. We have almost 12,000 employees. It's a fantastic place to work, and I'm very grateful to work in this organization, especially one that prioritizes well-being and wellness so heavily.
So what drew you to medicine and subsequently to pursue that leadership role beyond treating patients?
If I can be perfectly candid about my path to medicine, it actually began with my plans to be a veterinarian when I was in grade school. And I actually was all the way through college was majoring in animal science. But once I actually had some hands-on care of animals, I realized that I needed to explain to my patients why they were suffering, and that was really difficult with animals. And so I was struggling with that, and then realized that, while I was very drawn to the science and the physiology of healthcare of animals, there was a lot of trends that could be translatable to another population, and that actually sparked my change into human medicine, where I can actually have a relationship and a conversation with my patients. So that is my unusual path towards medicine. In terms of my leadership role, I think probably while I was a resident in emergency medicine, probably about midway through my training, that I realized that while I found it so meaningful to impact individual patients' care, that there were large system issues that affected my patients and my coworkers. And I really wanted to have a way to improve the system and the environment in which we provide care. And I wanted to affect change on a larger scale. So I started thinking about gaining additional training in administration. So after completing my residency, I did a fellowship in administration and then worked within the Emergency Medicine Administration for several years, opened our freestanding ED, And then developed along the way an interest in well-being and wellness work, and decided at that point that I really wanted to move to a system level role. During that transition process, also went back to school yet again, which many of us do, and got my master's in healthcare delivery science, and subsequently was appointed director of provider well-being for our health system, and have opened our Center for Provider Wellbeing here at Christiana.
I love that it was that you couldn't have a conversation, with your dog to be able to explain to him his suffering. That is what drew you to medicine. I understand that.
It's really funny. I've had that conversation I've had multiple people ask me that, and I'm always so sheepish about stating that was my path towards medicine. And I have had more people than you might think say, me too. Oh my gosh.
That's great. So tell me a little bit about your leadership style and how that has evolved, and especially if you have an example of either an experience or a mentor that was really influential in defining how you lead.
I think there are a lot of different leadership assessment tools out there, and leadership characterization tools. And anyone who's been in a leadership role for a while has been exposed to a slew of them. But what I've learned through doing these assessments and 360-degree evaluations and several years of professional coaching, I've learned that one of my strengths in my leadership style is that I excel at inspiring others to enact change. That I'm very good at setting a vision, empowering people around me to act, and then kind of clearing the way for the magic to happen. It's really about creating the conditions for excellence and then getting out of their way and removing barriers along the way. I enjoy a very affiliative kind of participative management and coaching style with my team and with the people that I lead. And I feel like that has served me well in creating this environment where we have a great deal of psychological safety on our team, and that kind of translates out into the broader culture as well. In terms of an experience, I definitely had several mentors along the way, and I could take up the entire time talking about them, but there definitely was one particular experience that was formative for me and really caused a shift in my career direction. And that was actually a clinical case that I had when I was working in the emergency department, and had a patient come in who was actually one of our employees. And I saw her in the emergency department, and I discharged her from the ED, and she unfortunately went into cardiac arrest on the way home from the emergency department. And that case and the fallout from what happened to my patient, really one of my colleagues, was a career-defining experience for me. And as anyone who has had a really jarring adverse event like that, or a subsequent lawsuit, knows that can be one of the most difficult periods in a physician's career. And so I definitely struggled for several months to years after that event. And it made me take stock really of why I went into medicine in the first place, what I found most meaningful. And I had to do some really hard work around my goals in life and in my profession. And it was actually as a result of that case and the sort of trauma for myself that surrounded that, and the sense of feeling alone and unsupported by the system, that made me do some research and how we handle adverse events as health systems, and delved into the literature around second victims and the need for peer support. And that actually started me on the well-being and wellness journey that I am now on. So as a result of that case, I decided to launch a peer support program for our health system. And that was really my entree into then deciding to dedicate the rest of my career and move more from a clinical role into an administrative role in order to enact many of these wellness programs in our organization.
That's absolutely wonderful that you took something that was such a traumatic impact on yourself and then really were able to take that and use it to care for others and really build the programs that can help others not feel so alone in going through something like that.
And I think that we underestimate the importance of sharing stories like that in medicine. There's a lot of power in our personal stories and in sharing and sort of having that vulnerability with one another when it's safe. Because I think that so many of us in medicine are experiencing some of the same challenges, and yet there's a barrier towards sharing that and to so powerful because it's normalizing. Oh my gosh, there's nothing wrong with me. I'm not weak, or it's not that I can't hack this because I'm having a hard time. This is a normal reaction, a normal human reaction to a very abnormal set of circumstances, whether that be, an adverse event like the case that I described, or, working in an environment that is a more toxic environment, or all of the huge discussions around burnout in healthcare, and understanding that it's much more about the environment in which we work. And so normalizing those discussions, and even, help-seeking behavior when we're suffering from mental illness or distress with one another, to sort of decrease some of those barriers to achieving wellness. I think so. Using those personal stories are super important and powerful.
Mother still, to this day, says, one of her favorite expressions is shared pain is lessened. I think that's very true when you're able to share the story and really help people understand that they're not alone.
Exactly.
So as the number of women entering medicine has actually surpassed the number of men enrolling in medical school in the last couple of years, what do you think are really those places of workplace inequities that we really need to start with in the medical profession?
I think that there are some concepts that are broadly applicable no matter what environment you're in, a female physician or a female in medicine. Concepts like the dual role burden, where, you're having to be the caregiver at work and the caregiver at home more frequently when you're a woman. And then the double bind, where you're either too aggressive or too soft, but never quite right. I think that those are concepts that are broadly applicable both in medicine and in business as well. But I think to some extent, using the expression of all politics are local, we dive into some organizations, we find out that those inequities are predominantly around perhaps compensation and the lack of transparency around promotion, for, let's say. It's about revising HR policies more in line with equitable care, or it's about beefing up leadership training for women within an organization. And in other organizations, or in pockets within one organization, there's much deeper culture work that needs to be done, let's say around concepts like toxic masculinity and its role in creating organizational dysfunction, disparities, and certainly for some women, personal despair. So I don't think there's one or two things that I can point to that are the be-all and end-all, but I do think that one of the reasons I'm so excited to support the work that the WEL Project is undertaking, because it is such a crucial topic for us advancing in healthcare and making sure that as our numbers of women are increasing, that we are creating an equitable environment in which they can flourish.
So tell me a little bit about your strategies for preventing burnout. Obviously, you've done quite a lot of research and understood where the drivers are, and you lead the institute. But how do you maintain your own well-being, and how do you support others in doing so?
Ironically, my nature by default is that I'm probably one of the worst offenders here, which probably makes me fairly well suited to my role, because I really get it. I get how easy it is to get to an unhealthy place in terms of your work-life integration or balance. But in my role as the Director of Provider Wellbeing, it really is part of my responsibility to model good self-care and to promote a culture that fosters well-being. So for my immediate team, that means really making it okay to set limits, to say uncle, that I've got too much on my plate, to come in late or leave early once in a while because we need to attend to personal matters, to protect our vacation time and our time off whenever possible, so that the team feels like it's okay for them to do that too. So I have to sort of model that culture within my team. it's so ironic because we really did have this conversation within our team and within our Center for Provider Wellbeing that we are so passionate about well-being that we work ourselves really hard and we have to really pay attention to that and attend to it more so than anyone else, because if anyone can do it, it should be us. But for me personally, it means taking my own temperature on a regular basis and kind of recognizing when I've pushed myself too far and having the courage to scale back, even if that means I have to say no to my boss. And it means staying connected to my support system, especially when I'm overwhelmed and sometimes feeling the desire to isolate myself, put my head down and get my work done. Those are the times when I actually have to be more purposeful about connecting with that support system. And I have to remember to prioritize myself. I am really good about putting myself on my own calendar. So I put my gym time on my calendar. I put my time that I'm going to go have coffee with my best friend on my calendar, and I protect that pretty fiercely. It's the old put your own oxygen mask on first, and so we need to take care of ourselves in order to take care of others. So that applies for me, for my team, and more broadly for our organization.
So to wrap up, tell me a little bit about what makes you hopeful for the future of medicine, both in general terms and then for the profession.
I finally see that there are some substantive efforts happening to humanize medicine, to kind of bring back some of the joy in work and to reconnect us to what is meaningful to us as physicians and healthcare providers. We're seeing a lot of data out there about the importance of well-being work. There's energy around this topic. There are people sitting up and taking notice. And increasingly, there's pockets of health systems and organizations that are making real changes to advance the professional fulfillment and well-being of our clinicians. I really think we are reaching a tipping point. And I have hope that it is possible for us to flourish as physicians throughout our careers.
And I think it's important to note in what you just said that none of that implies that you're working less. In fact, you're probably working more. But it's about working in things that really fulfill you and connect you to your purpose.
Exactly. I could not have said it better.
Well, I want to thank you for both serving on the WEL grant and serving as our steering committee member and providing your expertise there, and then for talking with me today. And I look forward to talking with you again as the grant moves forward.
My pleasure, Lisa. Thank you so much.